Good morning, everyone. Woo! Thank you so much for joining us. I'm so happy to see all of you. This has been a lot of work, and I want to first recognize Dr. Daniel Murdoch, who's really pulled this together with Chris Donis and all the other team members, because this is our first Stigma Summit in New Orleans, and we are so happy that we can make this happen. Never before do we have the tools in our toolbox to be able to really end the HIV epidemic. You know, for many decades, we have resources to pay just for medications, for services, but we never receive funding or the support to be able to do all the other activities that really impact ending the HIV epidemic, and that includes getting the words out about HIV. You don't really see that in the media, right? When we first came out, it was a death sentence. You saw it everywhere. Now, you don't really see it in billboards, in commercials, up until the last couple of years. The New Orleans Ryan White Services and Resources Office, which is a division of the New Orleans Health Department, received Ending the HIV Epidemics grants. And with that grant, we were able to host this event today. And so as you go through today's session, really think about what are some things that we can do to end the HIV epidemic. We have the opportunity to really make an impact in not just the healthcare setting, but in law, in the school system. There are so many different things that we can do to help educate and talk about HIV. I do want to start off with that. What we do here is being heard globally. It's not just New Orleans, right? We do the work in New Orleans, but people around the world knows about New Orleans, about the good work that we do. And this is just another step to take us to that next level. We have signed on to Fast Track Cities to reach 95, 95, 95, and that is with the support of our mayor, Mayor Cantrell. We are doing things nationally. We have a direct line to the White House. You know, Harold Phillips, who leads the national AIDS policy out of the White House, has said to me last year, I think New Orleans can do it. I think New Orleans can really end the HIV epidemic. You let me know what you need. So that's why we're here today is you guys think about what is it that we can do to end the HIV epidemic. It starts with our family and friends, and then it goes into our network, and then we have to work at the system level, policy level. So those are the things that I really, hope that you would think about what we can do differently, what we can expand, and how we can really move the needle in ending the HIV epidemic and getting people to undetectable status. Our mayor has been a supporter and a champion for public health and especially for HIV services and our program. What has struck me the most is when she first came into office, we had a health department meeting, and she came to that meeting, and she stayed for the whole meeting. She stayed and learned about all the different components of public health. She learned about our program, which some of you may know as the Office of Health Policy and AIDS Funding. This year we've changed our name to Ryan White Services and Resources. And she has been participating in many different activities to support the work that we do. So not only do we have support at the national level, we have support at the local level. And she's the type of mayor that rolls up her sleeves and has jumped in and really have gotten the work done. And we would not be able to have all the different support that we've had without her being there, without the health department support, Dr. Jennifer Avegno. So I really want to thank them and applaud them for all the work that they've done and have supported us on. Sometimes just the word alone, HIV, people don't say it. And now you hear it, you hear about it, you hear the mayor talks about it. She talked about it when she went to DC last week. Normally she would try and join us for the relaying, but she was hosting the president of France, So what we do is getting out there and people know about us. And with that, I'd like to show a video of her saying a few words to us.
Hi, New Orleans. It's me, your Mayor, Latoya Cantrell, and I'm so excited to kick off our Bounce to Zero campaign to end the HIV epidemic in New Orleans and our entire metro area. Our efforts can reduce our new HIV infections by 95% by 2030. I'm asking you to take this pledge with me. It starts on today with World AIDS Day. So with that, you can go to bouncetozero.com and you can easily fill out that pledge form, and I'm going to do that with you right now. So click on bouncetozero.com.
All right, thank you, Mayor. Before I introduce the next speaker, I'd like to get a little housekeeping done. First off, please put your phones on silent. And if you need to take a call, please step out of the room. Also, bathrooms are, if you go down the hallway, take a right, and it's all at the end of the hallway. First person I'd like to introduce is my friend, Nupcius or Earl E. Benjamin Robinson. Is a board-certified public health practitioner with the National Board of Public Health Examiners and health equity strategist. He's a 20-year-plus public health practitioner who has led and developed many HIV care and prevention efforts for nonprofits, health departments, and healthcare systems. Dr. Benjamin Robinson is a faculty at Xavier University at Louisiana's Public Health Sciences program. He developed and served as director of the Louisiana Department of Health, LDH, First Health Equity Office, and now officially known as the Bureau of Community Partnerships and Health Equity. Thus, he led the development of LDH's first agency-wide health equity plan. Lastly, he has been a member and led HIV care and prevention planning bodies in both Mississippi and Louisiana. Dr. Benjamin Robinson.
Is that my groupie? Who was that screaming? Was that you? I knew it was you. Good morning. How you doing? I was looking for you. Okay. Good morning, everybody. Everybody doing good? I am glad to see so many familiar faces, people committed to this fight. I am excited to be, to start this conversation with you guys this morning about bouncing to zero. I want to thank Vasna for that beautiful introduction. I also want to thank Chris Dantes for reaching out to me to be a part of this, Dr. Daniels, the Mayor Cantrell, for being so committed to public health inside the city. Make sure I'm not forgetting Dr. Avegna and the New Orleans Health Department for continuing to fight for people living with HIV. So thank you so much for having this event and inviting me to be the morning keynote. I'm not going to be long. My day is really busy. I'm going to be stepping in and out of the conference today, but I will be back towards the end of the day to do a closeout. And so, again, welcome to 2022's New Orleans Health Summit, Stigma Summit, Bounce to Zero. Thank you again to all of you for allowing me the opportunity to be here. I am indeed honored to be here today and thank you for allowing me to speak to you all. Let me also take the time to just say, thank you to the citizens of this strong, old city who always show up. And so what I want each of you to do today is to continue to do, one, the work that you've always been doing, but share that work more with individuals inside your community. I hope it is understood, especially to those of us in this room, that there is a symbiotic relationship between stigma and HIV. People who experience stigma and discrimination are already marginalized and made more vulnerable to HIV, while those living with HIV are more vulnerable to experiencing stigma and discrimination. In the Journal of International AIDS Society, in a Journal of International AIDS Society article written by Reyes, Galvo, and Deere, they write that stigma and discrimination are among the most negative and harmful social responses and they have been present since the start of the HIV pandemic. There is more discrimination towards people living with HIV in places with certain social, cultural, and economic contexts, negatively impacting on universal access to prevention, treatment, and health care related to HIV. Some societies fuel stigma and discrimination related to HIV by adopting laws and punitive practices related to the transmission and exposure of HIV, while also cultivating social and cultural punitive practices that affect others that live or operate outside of social norms. All of us have grown up being conditioned or nurtured by society, communities, and cultures, values, attitudes, and beliefs that have and still do create, in many cases, and exacerbate HIV stigma and discrimination. We have talked and learned HIV discrimination. That same HIV stigma and discrimination that continues to contribute to people not getting tested. It contributes to people and communities fearing and treating people, mistreating individuals living with HIV. It also affects people not adhering to their drug treatment consistently or remaining in care. The outcomes I've detailed have a unique correlation with our society's accepted bad behaviors and social norms of dismissing, ignoring, and discriminating against the vulnerable and historically disadvantaged. Further, those norms do not only perpetuate HIV and AIDS stigma and discrimination, but these social norms, our social norms, also perpetuate transphobia. They also perpetuate racism. They also perpetuate homophobia, xenophobia. But these social norms, excuse me, I lost my place, condemning and ridiculing poor and many other isms and are harm, shame, and low self-efficacy producing actions. So when we talk about HIV and AIDS stigma and discrimination, we need to also be talking about transphobia. We need to also be talking about homophobia, racism, xenophobia, and condemning the poor. This is important to note because, as I articulated previously, there is a symbiotic relationship between stigma and HIV, meaning that the mark of disgrace associated with stigma and the unjust or prejudiced treatment of the poor, African Americans, trans women, gay, same-gender loving men, Latinos, and other vulnerable and historically disadvantaged groups merge with the mark of disgrace associated with and the unjust and prejudiced treatment of people living with HIV. These are two factors that can and do stand alone. However, in our society, we all have witnessed how stigma and discrimination of the outgroups sync synergistically with HIV stigma and discrimination, and we all know of the sad, unjust, and preventable outcomes of this perfect storm festering in our society and communities. So we have some things to do. We have to go beyond the work that we do in the buildings that we work in and share our information and speak loudly and stand up for people. And I know everyone in here is doing it. I know a number of you are already doing it, but there's room for us to do more. And so I encourage us to continue to think about how we can do more as it relates to HIV. Mr. Rogers said, look for the helpers. James Baldwin said, not everything that is faced can be changed, but nothing can be changed until it is faced. And Martin Luther, the King, said, injustice anywhere is a threat to justice everywhere. Whatever affects one directly affects all of us indirectly. We are all helpers. We are all talking and facing, we can all talk about and face the truth. We are all able to use what we have, use our abilities, use ourselves to carry a message of protection for others, particularly those living with HIV. Thank you for allowing me the opportunity to speak today. Have to go run, but I will be back. But before I do that, I want to just briefly go over the agenda. I know it's up, but I mean, we have a lot to cover today. I, again, am the morning keynote, and so we've done that. And so next we're going to be having from 9:30 to 11:30, we're going to have stigma in healthcare settings, a panel discussion examining the ways in which systemic and institutionalized stigma exists. Then from 11:30 to 12:30, there will be lunch. At that 12:30 to 2 o'clock, we will have 3 breakout sessions. The first one is called Impact on HIV Stigma from a community perspective. The second breakout is people who use drugs and HIV stigma. The third is criminal justice and HIV stigma. We have a break at 2 to 2:15, and then we have 3 additional breakout sessions between 2:15 to 2:30. The first one is cultural competency training for healthcare workers. The second one is there are 2, advocacy training for community members. And then a third, the last section is from 3:25 to 4:30, reflections and next steps. And I will be back before that so that I can wrap us up. I believe Dr. Avegno will be a part of that session as well, so I look forward to talking with her. Thank you guys so much. I am double booked, so I'm going to run across the street, but I will be back this afternoon. I hope that, again, I know that we're speaking to the choir, but I think that, when we have these kind of opportunities to fellowship, I want to encourage you to share your experiences with the individuals that we'll be sharing with you today. I think all of this fellowship can be productive and useful in the work that we do. And we can also help to lift each other up, because sometimes in this public health sphere, we don't have the support that we need. And we feel like we're out here alone, but I know that everyone who is in this room is committed to HIV, and I've seen all of the work that each of us does in HIV, and so take this time to really just get reconnected with those of us in the city of New Orleans who are truly rooted and committed to the communities and better serving people living with HIV. Thank you guys so much. I will be back, and I hope you enjoy your day.